I think health-wise we've never been in worse shape than we're in now. You know, there's the epidemics now in children. I used to be a pediatrician, but the epidemics of autism and cancer and ADD are like never before. Solutions that don't really work, that are pressed and pressed and pressed until the thing explodes, and then some other vested interest comes in there and they're selling you that thing. But truth, real workability, real help, man, that's rare.
The association with Dr. David Minkoff for us is extremely rare and a completely valuable association. He's the example that has helped us know the importance of the connection between the dentist and the physician. Siloing out physicians from dentists is the wrong approach. He's the example for us that's brought to light the fact that there's a true connection with this oral condition and the rest of the body. This is a high purpose line for us to fulfill in natural dentistry. I present to you David Minkoff.
All the names in the medical textbooks and all the diagnoses and all the codable stuff is mostly just worthless. I mean, it's really worthless. I don't pay any attention to it when I see someone. I've got lupus, or I've got MS, or I've got Parkinson's, or I've got Lyme disease, or I've got breast cancer. It's all just nomenclature with no real understanding of what is wrong with this person. You know, what are the mental, emotional, physical universe factors that have summed up to this thing that they've got? And it's often somewhat complex, and so the more tools that we have to sort of unravel this thing, then we can actually help someone, and that's what we do. So, you know, I'm looking at all these things because then I can target my therapies, and it really comes down to two things. There's things in their body that shouldn't be there. We live in a very toxic environment. We're all full of heavy metals and chemicals and pesticides and all this kind of stuff, and those are poisons. They're all poisons. And you put them with cells, the cellular function goes down, and then things don't work. If it doesn't work in your brain, well, maybe you've got Alzheimer's, or you're depressed, or you're psychotic, or you can't sleep, or you can't think straight, and you've got brain fog. If it's in your liver, maybe you don't toxify. If it's in both, then you really have a problem. And so, you know, so these are the things that happen. The people are toxic. And a lot of times people are on medications. You know, they're just on medication, and that makes them toxic. The other part of it is that their body's missing things. If your gut's not working, or you don't have digestive enzymes, or you're not eating a good diet, or you don't have any teeth and you can't chew, then the chances that you have deficiencies of the 84 different things that have to be in the body in order for it to work, the vitamins and minerals and amino acids and essential fats, then your body doesn't have the tools it needs in order to produce energy and detoxify stuff. And so if we can figure out what are these things, then we can put together a program to get the stuff back in that should be and get the stuff out that shouldn't be, and it simplifies it a lot. So that's how I'm simple thinking. Like, all great things are simple. They're not complicated. And the public's really interested in it because they're seeing now that they don't want to be this way. They don't want their kid to have autism. They don't want to get cancer. They want to be 50 and feel good and continue to work and play. And I want better times in my triathlons than I did 10 years ago. And how am I going to get this? Well, my doctor doesn't have a clue. Nothing against him. He just doesn't have a clue. He doesn't know what to do. But there are guys who have answers. And I'm looking. Who does this? Who knows this? Who can help me so that my life can be enhanced? And of course, I'm doing that with lots of people because I see them in the practice. And that's what I want to do for them. I want their lives to be enhanced. And it's information. And if I give them the right information and they put their attention on that information, then they can get better, they can change their habits, they can do better things. And I think this is where the renaissance is. And I think that the clampers are getting yanked off because now, you know, even the FDA is having trouble holding this down. So it's coming off because people are sick and tired of the lies, of the things that don't work. Poison Control Centers of the United States. They keep a record every year and they do a tally of everyone that either calls or comes into the poison control centers, and there's one in every state in the United States. And they keep track of who took what poisoned them, who lived, who died. Not one person last year or in the last 10 years has died from a vitamin, a mineral, an amino acid, an herbal, a homeopathic. Not one person has died per poison center recordings. We know that at least 700,000 people died last year from drug reactions. Now that's a lot of people. And if you think of it this way, a 747 jet holds somewhere between 300 and 400 people. What if in the headlines one of those crashed every day last year? That would equal about 700,000 people. 365 days, 300 people dying of a plane crash every day. 700,000 people died last year from drug overdoses. And who do they go after? Well, they go after vitamin companies and mineral companies and herbals and homeopathics. We have a bunch of German homeopathic companies they make superb products. The FDA said, well, you're drugs. And now when oxygen is taken into the body, what is supposed to happen in a body that's healthy is that oxygen goes into the lungs, into the blood, into the tissues, and those tissues have little factories inside of them called mitochondria. And the oxygen enters the mitochondria, and that oxygen is burned with fuel. It can be protein or fat or carbohydrate. And the waste product from that burning is carbon dioxide. And then that carbon dioxide leaves the cell, goes into the blood, goes back to the lung, and is breathed out. So if we measure amount of oxygen in and amount of carbon dioxide out, we can see how good are those mitochondria at making their energy particles, which are called ATP. And everyone has a genetic sort of, here's what you could do, but you can measure how well does that happen. Now, if the mitochondria are broken or damaged, really they're toxic. So when you put lead or mercury or a chemical or a pesticide and you take it in your mouth or you breathe it in and it goes into the body and it gets into the cell and then it gets into the mitochondria, then that delicate mechanism where it takes an oxygen and it makes a CO2 gets so that it takes an oxygen and it doesn't make a CO2. And then that guy can't use oxygen anymore to make energy. And his cell has to do something else, and it goes from an aerobic cell, which means using oxygen, to an anaerobic cell, which means it's not using oxygen. And that's sickness. So if you're walking around in pain all the time, you have a lot of anaerobic metabolism in your muscles and in your tissues, and that's why you feel that way. Your body can't utilize the oxygen to make CO2 to make energy. All cancer is broken mitochondria. They can't use oxygen, and they're anaerobic cells. So those cells are anaerobic, okay? And their waste product, instead of being CO2, which can be breathed off, is lactic acid. So their tissues get acidic and their body gets acidic. And that makes them sicker because things don't work that well when things are all acidic. A lot of the people we see have fatigue, or they don't have any energy, or they say, I just can't get out of bed. I can't go to work. I can't think. I'm in brain fog all the time. And what we found is that Those guys at rest, their mitochondria are so broken that they're at rest as what a healthy person would be at a full-out sprint. They're anaerobic at rest. That's why they can't move. That's why they can't think. That's why their liver can't detoxify. That's why they hurt all the time. Because their body is so, their mitochondria are so broken, really toxic, that they're anaerobic. And they're pressed, they're like, as you would be if you were running a full-out sprint after like 1 or 2 minutes where everything is sore and you can't catch your breath and you can't even go another step. That's where they are at rest. That's how sick they are. So this helps us. Because on those guys, I don't even put them on the bicycle. There'd be no use. They couldn't do anything. But I can show to them, look, you're not crazy. This isn't a psychological disease that's wrong with you. You don't need antidepressants for this. Your body is so toxic that it can't use oxygen to make energy, and we have to repair your mitochondria. And the program that we're going to go on is to start to get your mitochondria healed. And as that occurs, your energy is going to come back, your thinking is going to get better, your depression is going to lift, your sleep's going to get better, your body is going to, you're going to start to be able to do things again. One of the major, highest priorities in many of these sick people is the state of their teeth. In my experience, the highest, most toxic thing that a person can carry around in their body is a root canal tooth. The root canal is a dead tooth. It's infected with anaerobic bacteria. They produce biotoxins of the highest order. It leaks into their body and it makes them sick. One publisher said one root canal tooth will depress the immune. I think this was Boyd Haley, who's professor emeritus professor of chemistry at the University of Kentucky. One root canal tooth suppresses the immune system by 63%. So huge major factor. So when I'm looking for why can't this guy move or think, or why do they have cancer, or what's wrong with their body's energy systems, my first thing is like, how's their mouth? You know, how's their gums? Do they have dead teeth? Do they have root canal teeth? And then do they have a lot of bad materials in their mouth? You know, mercury and gold and these sorts of things. Because if I'm going to unburden them, often that's where the highest priority is. And then I need a dentist who understands that. So I couldn't do it. I couldn't do it without the dentist because I'm not a dentist. I can't do that. And me sending a patient like this to your general oral surgeon or your general dentist and say, hey, this person has 2 root canals and I think that they're toxic. Could you analyze this for me and check it out and do your 3D cone beam x-ray and show him that he's got an abscess sitting there that isn't good, and then help him get rid of this burden so that I can help him the rest of the way? I'd be like talking to a wall. You know, it's just not, it's as, you know, dentists probably are do some good things, right? They get people to brush their teeth and they floss and they clean them every 3 months and all this. This is all good, but many times the materials that are used and the procedures that are done are not the best thing for the patient in the long run. And so when it comes to the point where those materials or those procedures that have been done on the patient are now detrimental to the patient, so we have to step in and we need biological dentists to do something about it. If we add one more factor into this, which is inflammation, because now we know that cardiovascular disease, roots of it are inflammation. Cancer, the roots are inflammation. Chronic autoimmune disease, inflammation. But what happens pre all that is you have this disabling of the body's ability to create and handle energy, to make energy. So that if you have a cell or a group of cells, say an organ, and that organ is able to make enough energy to process toxins, because it takes ATP. It takes ATP for it to, it takes ATP for you to think, and for you to move, and for you to detoxify. And if you get inflammation, if you get toxin, the sources of inflammation are infection and toxins. So those things get in there, and the body's response to those things is an inflammatory response. Now, if it's overwhelmed with those things, it can't do it. If it had enough resources, it could deal with those things. It could deal with a big load of bacteria. It could deal with a big load of toxins, because it could then process it and handle it. And what we see in sick people is that as their load comes in and their mitochondria function less and less and less, and more loads coming in than less mitochondrial function, then the attempt is to try to get an inflammatory response, and pretty soon it can't keep up, and then the body can't defend itself, and then these things sort of take over. And like in the chronic Lyme patients, they've all got, it isn't Lyme disease that gets to the people. It's Lyme plus root canal teeth, plus they got parasites, plus they got a leaky small intestine. They've just got piles on piles on piles of stuff. And if you give them a drug to stop inflammation, which is what a lot of the pharmaceuticals are, whether you're talking about aspirin or prednisone, steroid type drugs, or these new ones which are cytokine blockers, Humira and Enbrel, they're basically just cutting the legs right out from underneath the whole inflammatory response. So now the body just doesn't respond at all. So yes, my psoriasis is better, and yes, my arthritis feels better, and yes, and you hear the disclosures on the TV on these things are almost as long as the ads. If you have TB, if you have this, if you have that, yes, you could get this cancer, you could get that cancer, you could get this, because we're going to basically kill your immune system. And for a little while, maybe a few years, maybe longer, some bodies will tolerate it. You won't have symptoms. Does it do anything at all for the underlying cause of why you got that? Absolutely zero. And so it puts you in big, big, big jeopardy if you ever want to really be well.